Good afternoon, my name is Aura and I am doing my video on Unit 6 and the setup for the two of the procedures. I actually have my table here set up for one of them, and this one is for the reduction mammoplastic. Sorry about that. This is my table, all my setup, me, my gloves on. I actually have a gown today under my uniform, and you can see I also have my nice boot up the way up. And let's get started with this and see how we're doing today. So excited. Okay, so to continue, my table is set up with my OR towels. Okay, I do have my OR towels. I have, here we go. These are the surgical OR towels that I have in here. I also have my, lamp sponges. Okay, nice lap sponges right here. Okay, and these normally come in a group of 5, in a pack of 5, I should say. 1, 2, 3, 4, 5, and this is a counting item in the OR setup. Okay, the same thing with the OR surgical towels. They're also a counting item. I have, just beforehand, before we start any surgery, the scrub for the surgeon and for the surgical tech before getting sterile and all of that. You gotta wash all the way up to here and dry. I have my drape for the stand, for the myo stand. I also have the drape for the patient. Okay, it has instruction how to place it, how to unfold it, and how to put it on top of the patients. I do have more OR towel if needed, or surgical towels if needed. Because of the surgery that I'm having today, the reduction mammoplastic, I have also the big bassinet here, just in case we need it for to place any extra tissue in there. I have the small one just to get any sponges or anything wet, and I also have the bassinet or the kidney dish, because it does look like a kidney here. Yeah, and the kidney dish or the MSS bassinet. Okay, this one that can be used for to put anything like medical surgical work. They use it for like any waste, soiling, any dressing, or anything that is already all saturated. Okay, and then the medical cup, which it could be a metal and they can use, or a plastic one. Okay, I printed this for us to see. Okay, now for this procedure we are going to be using something called the Wetlander retractor. Okay, so the Wetlander retractor, it helps to open up the incision little by little. It's a finger, so you gotta hold it and open it up little by little, and then this little handle right here keeps it tight and open so it won't close on you. Okay, it looks, it says a cam crash lock used for holding back tissue and exposes surgical site. It has a curved shunt, which is right at this here, that leads to the blade that have been between 2 and 6 sharp or blunt. The outward curving prong. The prong is intelligent when it's instructed and closed. Integrated, I'm sorry, when prompt and closed. So that's a fancy one, and I don't have that one on my instruments that I have with me. And so I'm using my little printout cards that I got from online. And of course, because we wanted to make incision, the incisions are big, we're gonna use the bipolar cautery. And the bipolar cautery also cut and coagulate the blood while you do the cutting, and so there's no bleeding after. And this can be used near the nerves or near the vessels. Okay, I also have dissecting tissue forceps. Okay. This one, you can see that there's like a little T at the end of the forceps, right? It's kind of hard to see. I try to find one similar to this one that I had, but I couldn't find it. But it has like little teeth to grab. Okay. For this surgery, they are requesting, or they require 2 knife or 2 blade, I should say, or needle, the handle, the scalpel. So a number 3, which is this one, and then a number 4, which is this one too. Okay, for the blades. Blades are in here. Once we need them, they are put right in here. Okay. So that's that. And then we also have, of course, we're gonna use suction, the Hooker suction. This is to, you know, suction any extra fluid or any blood from the incision. I also have in here what is called the overhaul fine dissecting forceps. Okay. So this one also opens up and then clamps right in here, so it grabs and won't let it go. So this one is used in many different surgical procedure, and it's the principal use. The surgeon uses this during procedure, and that requires adequate control of the hemostasis, so to stop the bleeding. Okay. For this purpose, the instrument features a pair of curved jaws with fine serration at the end of the grip, and then you can see it at the end. There's some serration right here. So it won't cut, but it will hold it tight. Okay. I also have here the Alice tissue forceps. Didn't open it, but it's right here. This is the Alex. Okay. So the Alex is for just to hold anything out. Okay. I also have here the cryo wood needle holder. To hold when you're doing stitches or to hold any tissue. Okay. I have the ring forceps. Okay. The ring forceps is a little gentle instrument that you can hold any tissue and it won't harm the patient. Okay. This is also called the stick sponge. Okay. I also have here the retractor, okay, the fairy ball retractor, and this is one of the most popular handheld retractor, and it allows the surgeons to grasp, retract, and hold multiple types of tissue during a procedure in a broad range of surgical specialty. So very important. This is used in a lot of procedure, a lot of surgery. Okay, this has like the L-shaped blade for a reliable retracting. We also have the penetrating or the OR scissor. Sorry. Of course, this one is a small one, but they have a big one, and this can cut through thick tissue. OR penetrating scissors. Okay. I have with me also the curved Mayo scissor. We have a short and we have a long one. Okay, so here we have a curve and a long one of this. Again, this one is also for cutting thick, deep tissue. Okay, with me I also have the Mayo scissor. This is the straight one. I have the curve right there, and this one is the straight one. Okay. I don't have this in my instruments, but I have the back cup. Okay, so the back cup is another instrument that you use on delicate tissue, delicate areas. One of the examples that this one is used because it won't cut through is like the bowels or the fallopian tube, and it's needed for like the veins or the vessels. I have with me here the Bookman rake. It does look like a little rake. Okay. This one is a surgical instrument used in small bones and joint procedure. It retracts the surrounding tissue to expose the surgical site. And this tool is manufactured with surgical grade German forged stainless steel material that increases the strength and makes it resistant to rust and corrosion. Okay, that's that. That's this right here. Okay. I also have with me, because we're going to need it for any sutures or any stitches that we have to do, and the Mayo Hager needle holder. Okay, this is the curved one, and we have a straight and we have a curved one, and they're also called needle driver. Okay, I have with me also the Mayo needle holder. This is a straight one. Okay, you can see it. This is a straight one. Okay. With me, I don't have it in here, but we use for this surgery, they use the traction forceps. It looks like this. Okay, there we go. It has like little hands at the end and clamps at the bottom right here, kind of tights it or locks right in there. It's useful. This is a useful tool for a variety of throat procedure. The small traumatic forces are designed for grasping of soft tissue and fascia, as well as traction of the skin. And the forces are available in two sizes depending on the surgical need of the surgery or the surgeon, how he or she wants it. Okay, I like this little one too. And this is a different one. Sorry, right here, the operating scissor, which I already showed it to you, is this one right here, the operating scissor. This is a straight one. Okay, straight long scissor. Okay, and I have with me the Babcock's towel back clamp penetrating. Okay, so this one, it can hold the towels or anything that you wanna hold. It has a special little teeth right there. Okay, so this is the large and the small. We have a large and a small penetrating towel clips. This is for cloth only. Okay, my last one that I have with me, it is the Mammopladty scissor that we are going to use too. Mammopladty scissor. This is a type of scissor that is used in tissue and dissecting delicate tissue. Okay, and just to finish, every time you do a surgery or procedure, you gotta mark your area. So I do also have my marker with me, and this marker also has a measuring tape on it. It all, you know, because you gotta measure the incisions or how big the incision is going to be. So you measure and document the size of the incision that you're making. Okay, I think that will be it for my reductions, and I am pretty sure that I missed some other things, but it's a learning and process. Thank you.